So the American College of Obstetricians and Gynecologists has just changed our guidelines with respect to pap smears. And it's a really confusing issue for a lot of women, so I just want to go over this and explain it a little bit. When Dr. Papanicolaou in the 1950s discovered that he could look at cells under the microscope from the cervix and determine cells prior to cancer, and he could find women early on in the course of a disease and prevent cervical cancer, that was an outstanding event for women and women's health care. And the amount of cervical cancer in this country and around the world really declined dramatically. So in my generation and all the generations after me, we were all told, oh, we have to go in there every year for our pap smear because it was such a dramatic improvement in women's health care. So what gives now? Why all of a sudden are we saying it's okay to go 3 years or 5 years without a pap smear? Well, in the 1950s, Dr. Papanicolaou didn't know what caused cervical cancer. All he knew was that he was able to find precursors or early changes in the cervix that made a difference, and that he could intervene and change the course of cancer by treating women with these early changes. We now, fast forward to 2012, we know what causes cervical cancer. It's actually caused by a group of viruses called human papillomavirus. That virus is everywhere. There are at least 100 different types of human papillomavirus, and there are only a few of them that actually cause cervical cancer. There's a vaccine for 2 of the causes of cervical cancer, type 16 and type 18, which will prevent most cervical cancer if one is vaccinated and has all 3 of the vaccines, but it doesn't prevent all cervical cancer. There are another maybe 12 or 14 types of the virus, much less commonly, but that can lead to cancer. So even women who've been vaccinated against human papillomavirus still need to have their pap smears. What we know now, though, is that if a woman tests negative for any of the high-risk types, and that's all 13 high-risk types, that she's really not at risk to develop cervical cancer. So now we're recommending for women ages 30 to 65 that they get 2 tests with the same swab, a pap smear and a test for human papillomavirus. And if you test negative on both, then your risk of developing cervical cancer in the next 5 years is negligible. It's just about 0. If you don't have the virus, you can't get the cancer. All cervical cancer is related to human papillomavirus, high-risk types. So that explains why the guidelines have changed. There's no longer a need to worry about we might have missed something with the pap smear, and so we have to do it every year, because now we know exactly what we're looking for, and we do 2 independent tests, making sure that you're negative on both before we say it's okay to go 5 years. Now that doesn't hold for women who have had dysplasia or high-grade dysplasia in the past. So this guideline is based only for women with normal results. Well, what about younger women? Women younger than 21 are exquisitely unlikely to develop cervical cancer. It is such a rare event that we really don't think screening of anyone younger than 21 makes any sense at all. You know, a screening test, to make sense, has to pick up things that we can intervene in and make a difference, and that just doesn't exist in that age group. Even though they may be sexually active, even though they may be exposed to a lot of things, they are not at risk, because it's the persistence, the long-term exposure to some of the changes of the human papillomavirus that lead to cancer. These are not things that happen in 6 months or a year. They take a long, long time. So our recommendation for women aged 21 to age 30 is that we begin screening at 21 and that we screen with the pap smear only. Well, why is that? Again, women in that age group are fairly sexually active and newly sexually active and getting exposed to a lot of those 100 or so different HPV types. And if we tested them for HPV, we'd find these transient or short-lived exposures that the woman's own immune system is going to clear, and she's going to get rid of them, they're going to go away and never lead to anything. And we don't really want to find those things because they scare us, number one. They make us feel terrible, number two. And number three, they might cause us to intervene and do things that we don't need to do. And those things can cause harm. If we start freezing, burning, microwaving, removing sections of the cervix in young women, we can cause scarring and damage that we really don't want to do. So the point is, in this age group, the pap smear is valuable. There are a few women, not a lot, but in that 21 to 30 age group who may have significant changes in the cervix and need additional testing and perhaps treatment, but they're not common. And they're not going to be helped by testing for HPV. Because they have so many infections, we would identify so many people that are really not at risk. And then from age 30 on, pap smear with human papillomavirus testing, and if negative on both, then every 5 years. What if you don't want to do the HPV testing, or let's say you don't have access to it? Then what we say, age 30 to 65, a pap smear every 3 years, because in this age group that makes the most sense statistically.